Hello class, it's Dr. T. This tutorial is to give you guidance for the submission of your PICO question for grading. Not only will your PICO question be graded for this course, it will also be forwarded to your assigned advisor so that when you meet with your advisor next week, your advisor will have a very good idea of the direction in which you're going for your evidence-based proposal. The vast majority of you have submitted your PICO ideas to the working forum and have received feedback from me. You should be fixing your PICO to go along with my suggestions, and then you must use the PICO completion form. I'm going to show you that form right here. It's under Assignments, Grading Rubrics, and Resources. So here's the PICO question form. Please be sure that when you open it, you download it to your computer and save it. Then open it up again to complete it. If you do not do this and you complete it right here, which you see you could do, when you go to close it, it will just disappear and all your hard work will be for naught. So please be sure you save it to your computer as this form, then open it up from your computer and complete it. Then when you submit it as an upload to the Dropbox for grading. So it's some of these areas are obvious. You'd put your name here. Make sure the clinical concern is patient-centered. You can talk about the cause of that clinical concern, but the focus must be patient-centered clinical concern. So what are the clinical problems that are related to the background problem that you are addressing? So for example, if there is a high rate of incontinence, urinary and fecal incontinence in the nursing home related to poor rounding and poor toileting programming. The toileting programming and the rounding are not the clinical concern. The clinical concern is the fecal and urinary incontinence and the consequences of that. Patient discomfort, UTIs, skin excoriation, loss of dignity, etc. Those are the clinical concerns, for example, for that problem. So think about your clinical concern as being in the patient, would be reflected by things that happen to the patient, for example, mortality, morbidity, discomfort, pain, anxiety, depression, all those things are centered in the patient. That's your clinical concern. Then, under setting and culture, you are providing the background of the actual institution in which you plan on implementing this evidence-based change in clinical practice. So you would describe the setting and the culture, meaning what is it like to be there? Is it a culture that encourages best practices, has a vision of being patient, family-centered? Is it a hospital? Is it long-term care? Is it a community health setting? Is it a psychiatric facility? Or in another good example from our courses, is it a prison? You can't just name it. You have to actually describe it and describe what kind of culture it is. When you're thinking of culture, think about what is it like to work there? Is there a sense of teamwork? Is there a commitment to excellence, etc.? The population are those patients who are suffering from the clinical concern you have identified. You've all been pretty good at identifying who your population is. Your evidence-based intervention would be the actual intervention you are putting into place. In many cases, you have chosen a clinical guideline. That is your intervention. So you would say that the intervention is the clinical guideline and name it. Your comparison. Don't make that too complicated, class. The comparison is simply to the current practices in your facility. Whatever your problem is, you are saying you're going to compare the interventions that you're going to put in place into what they're doing now. And remember, please, this is not a research study. You are not comparing in the sense of doing groups and testing something out. The difference between evidence-based practice and a research study is when you put into place something from evidence-based practice, the research has been done. So the problem is not to discover the solution. You already know the solution. You know the solution because research has been completed and has validated that the interventions or intervention that you are proposing is based on best practices because we have a body of evidence supporting that it will work and will result in the outcomes you are predicting. So again, remember, you're the project director. You are not a researcher. Then you would identify the outcomes. You've done well with that. Make sure again that they're patient-centered. They're in the patient. These are not they're not the institutional outcomes. They're not the outcomes for the nurses. For example, if your intervention is to put into place an evidence-based orientation program in the emergency department, which one of you is doing, the outcomes are not that the nurses are going to learn the material, although that's going to be part of your program. You are looking at what are the patient outcomes that will result from the nurses being more competent in the delivery of their care. So you've identified poor outcomes as the initiating clinical concern. Then the outcome that you are identifying for your project would be patient-centered. What better outcomes will occur for the patients because of this program? The time frame is very easily what you believe to the time it would take for you to present the proposal. This is after you've written it. So you present the proposal to your agency or institution and you get approval for the proposal, and how long will it take for you to implement it and put it into place and then evaluate it? I would say for the most part you want to put down a minimum of a year. And then you want to end with the envisioned purpose of the evidence-based project. Make that quite broad. The envisioned purpose of the evidence-based project is not to implement the intervention you're talking about. The envisioned purpose of the evidence-based project is what would result in the broad sense from the implementation of your program. So for example, if you are implementing an evidence-based program for creating an healing environment in the intensive care unit, the envisioned purpose of your evidence-based project would be to alleviate the pain and suffering and anxiety of those patients residing and are being cared for in the ICU setting. Do you see? You want to look at your global purpose for your project. The project will relieve suffering, will enhance the quality of life, will improve the quality of care and name what it is for patients in the ED setting or in the home care setting or whatever. So it's a broad term. It's a broad vision. If someone said to you, why are you doing this? Why are you doing this project? Think of what your one or two sentence answer would be, which would be, well, this project is a project where the quality of care for the patients will be improved. They won't suffer as much. They will be safer. So this project will improve the quality and safety of patients residing in this setting, or it will alleviate the pain and suffering of the dying patient. Do you see what I mean by that? It's a broad kind of perspective. That's it for your completion of your PICO question. Please use the form. Don't forget I said make sure you download the form first. And this form will be given to your advisor. You're going to meet with your advisor next week. I will be posting who your advisor is by the end of the weekend. I want to really look at all your PICOs and make sure we are assigning you to an advisor who will be the best advisor for you, has maybe perhaps similar interests and would enjoy working with you on the focus of your project. I will end with telling you you are doing exceptionally well. You've all worked very hard on your PICOs. They're very clear. And if you can just appreciate how far you've come in a very short time and how well you are beginning to understand the role of the advanced practice nurse as a project director for evidence-based change in clinical practice. Take care and please call or Skype me anytime.